Hi, Black Barbies. Good afternoon. Good afternoon to you too. If you are joining us right now, please can you please share this live to as many people to benefit from today's topic. Dr. Mike, you're welcome. Demi Okewale, you're welcome. Please, if you can hear me and you are just joining us, please share this live to everybody. Share it to your friend, share it to your contacts, share it for everybody. You understand? So that everybody can benefit from today's wonderful session. Dr. Festi, you are welcome. I am Anoti, you're welcome. Dr. Mickey, you're welcome. Black Barbies, if the customer service will reach out to you. So if you can hear me, please, so that we can. Okay. The customer service will reach out to you. That's Black Babs. Okay. All right. I am Anoti. You also said you recently downloaded the app as well. Don't worry, we'll reach out to all of you. Okay. So, if you're joining us and you can hear me, can you please drop a comment where you're joining us from? If you're joining us from Lagos, if you're joining us from Port Harcourt, if you're joining us from UK, US, Canada, can you please drop a comment so that we can know where you're joining us from and while we are waiting for our guests for today to join us. Okay. K Gold, Don Tinoye, you're welcome. Okay, you're joining us from Netherlands. Thank you very much. It's in a moment. We're waiting for our wonderful guest to join us today. Please, like I said earlier, please share this live to everybody. Please share this live to everybody so that all of them can benefit. All right. Okay, so while we are still waiting for our wonderful guest to join us, so let me briefly talk about what we do at TeleDoc App. So at TeleDoc App, we connect you to a doctor. You're welcome, Mr. Peter Chinedu. You're welcome to this live. Please ensure you are sharing this live to your friends and family so that everybody, we can all benefit all at the same time. So as I was saying, so at TeleDoc, we ensure that we make quality consultation. Oh, welcome our doctor. So I'll be bringing our wonderful guests up right now. Okay. So as I was saying, so what we do at TeleDoc is we make quality consultation easier for you. We connect you to a trusted doctor, a certified and licensed doctor, so that you can consult from anywhere you are, whether you're in Nigeria, whether in UK, whether you're in Canada, whether you are in France, whether you're in your bedroom, whether you're in your sitting room, whether you are anywhere, so that you can always reach and consult with a doctor from anywhere you are from or you are. So So a minute. Okay. 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 I think our guest is having issue with joining, maybe network. So as I was saying, so oh, wonderful, 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 wonderful. Can you hear me, sir? Doctor, can you hear me?
I can hear you. I can hear you.
Okay, so as thank you very much for joining us. Thank you very much for joining. So thank you. So as I was saying, so what we
The
do.
pleasure.
Okay, I can see you too. I can see you and I can hear you too.
Okay,
Doctor, I can
okay.
see you. Okay, so as I was saying, so some people they are already dropping comments asking us about what we do and how we operate. I'm just saying that at TeleDoc we connect you to a licensed doctor, like Dr. Kazeem is here right now on this live to give you insight and to enlighten you on a particular challenge issue that is affecting millions of people out there. So whether you are feeling sick, whether you have issue with your health, or you want to speak to a specialist, that's where TeleDoc comes in. TeleDocs have over 700 consultant, licensed doctor that you can have one-on-one consultations with. So good afternoon once again. If you are just joining us right now, please ensure that you are sharing this live to everybody so that everybody can benefit from this today's topic and from uh, our wonderful guest today. Please share this topic, share this live. Father Kemisola, you are welcome also. So let's dive right in. Good afternoon, everyone. Uh, I
Welcome.
still remain your wonderful guest. My name is Oluwatimila Ipareno, and today I bring to you another wonderful session, a session where we'll talk about health. And today I'm bringing a very wonderful and renowned doctor and the person of Dr. Kazeem Abimbola Uthman. He is a psychiatrist, and today we are talking about redefining, rethinking schizophrenia. So now I will allow Dr. Kazeem to properly introduce himself. Over to you, Dr. Kazeem.
Oh, thank you for having me. Uh, as you have mentioned, I am Dr. Kazeem Abimbola Uthman. I'm a consultant psychiatrist with focus on nutritional psychiatry. I've done a lot of work on the relationships between nutrition and mental illness. I am the current head of Department of Psychiatry, Federal Medical Center, Umaya. So
Oh, thank you so
that's
much
all
for
for now.
that. Thank you so much for the introduction, sir, doctor. So today
All
we are
right, you're
talking about.
welcome. It's a pleasure.
Okay. So today we are talking about schizophrenia. We're talking about the diet. We're talking about the lifestyle. So, uh, for starters, so can you please tell us what schizophrenia is? Can you? Yeah.
Okay. Thank you for that question. Uh, Schizophrenia is a chronic medical condition which affects the way we think, uh, the way we speak, and the way we feel. It affects about 20 million people worldwide and is a very debilitating condition that can impair functionality in all areas of life. So, schizophrenia has been said to arise as a result of chemical imbalance in the brain, most likely dysregulated dopamine. So, and the core symptoms of schizophrenia are four. Number one, positive symptoms. The positive symptoms are hallucination, where the individual begin to have sensations that are not there. Like, for example, somebody might say is hearing voices or people talking when there are nobody around talking. Delusion. Somebody may be saying that it's having maybe people are following him, people want to attack them, and then maybe they begin to have a belief that is false. And then there can be a disorganized speech where individual is talking anyhow. Then number two symptoms are negative symptoms. They can manifest as a result as apathy, that individual is no longer interested in is unmotivated, is aimless, is not willing to do anything. There can also be cognitive symptoms where the individual is having problem with memory deficit, and then problem with executive functions. So many things have been said to lead to schizophrenia. Number one is some say it's a genetic disorder, and this is evidence in the fact that it runs in the family, and is commoner in identical twins more than non-identical twins. There some chemicals in the brain have also been implicated in the development of schizophrenia. So those chemicals are dopamine, glutamate, and GABA. So these chemicals are said to be dysregulated in the patient with having schizophrenia. Some findings have also been observed in an autopsy conducted on the dead patient with schizophrenia. They said that some structure in the brains are missing. For example, the ventricles, which is a channel in the brain, is said to be enlarged in patient with schizophrenia. Even gray matter is also maybe there are lots of neurons in the patient with schizophrenia. And then some have said that insult during pregnancy can lead to schizophrenia, and so many other factors. So this schizophrenia, it has been a problem that people always get great.
You said something. Sorry to cut you. You said something about during pregnancy, insult during pregnancy.
Yes. Like if there is an infection during pregnancy, maybe the mother has an infection. It can also affect the baby and affect the neuronal development in pregnancy. Hello?
Yeah. Please continue, sir.
Okay. So, schizophrenia is largely being treated by antipsychotics. The reason for that is because, like I said that it's as a result of chemical imbalance in the brain, and that the culprit is dopamine. So, and for that particular reason, some they make an antipsychotic which target that dopamine. So at least to block the receptors of that dopamine in the brain. So, and that has been the problem for years. Even before that, there was no any reasonable treatment. But in the past, maybe about almost like 30 or more years now, there have been relief because of the development of those antipsychotics. But these antipsychotics, they are only able to treat the positive symptoms. They are not able to address the negative symptoms. So at the end of the day, the individual will just, though if he's hearing voices, he's no longer hearing voices. If he's having an abnormal belief, he's no longer having abnormal belief. But at the end of the day, even though he's not having those things, he will still not be able to function because of negative symptoms. This has been a drawback of the antipsychotics, which is the traditional way of managing schizophrenia.
Okay. Okay, doctor. Sorry, I want to draw you back to something about the causes of schizophrenia. Can
Okay.
schizophrenia be caused by maybe trauma, like maybe loss of a loved one or something? Or uh, can you hear me, doctor?
Oh, I can hear you.
Uh, like schizophrenia, like you rightly said, that it can be caused by a lot of factors. You talk about genetics, you talk about using psychotic drugs and the likes like that. I'm also saying, can it be caused by maybe trauma of losing a loved one? Some people can just start hearing voices maybe after they lose loved one and be like, okay, I'm seeing this person. So that's my question, sir.
Yes, the cause of schizophrenia is not that direct. It is complex. Like I said, because I'm still going to talk about it
Okay.
when I'm talking about rethinking schizophrenia.
Okay.
Uh, the schizophrenia is not, you see, if somebody is traumatized and is already predisposed to developing schizophrenia, that is when it manifests. So the trauma is like the genetics, is like the bullet that has been loaded in a gun, but the trauma is not the one that pulled the trigger. So
Mm.
what I'm going to talk about as we go on, I'm going to talk about how these things interact together to bring about the symptoms of schizophrenia.
Okay, okay, okay. So if you are hearing me from wherever you are, I'm live with Dr. Kazeem Abimbola Uthman, a psychiatrist, and we've been talking about rethinking schizophrenia. And please ensure you share this live, because this particular discussion will bless a lot of life, save a lot of people and family. Please share this live. And if you have any question to ask doctor, please can you please drop them in the comments. Doctor will attend to every one of them after we are through with the live. Uh, Doctor, please
Yeah.
let's move to the next stage. We are talking about uh, schizophrenia. We talk about the likely symptoms. We talk about the cause. Now let's go deeper into the topic. Let's go deeper
Okay. All
into
right.
it.
Thank you. Uh, what we are talking about is now rethinking schizophrenia.
Yes.
The traditional way of managing schizophrenia is when the patient comes to the hospital, the doctors assess the patient by taking history, and then there are some set of symptoms because we have documents that we call International Classification of Disease, 11 edition. We also have another document that we call DSM-5. There are some set of criteria in those documents. Now, by the time the individual presents and some doctor has some questions, then if those patients, if they meet certain set of criteria, let's take for example, in ICD, there are two categories of symptoms. The first category is maybe about four set of symptoms. The first one is that maybe the first symptom is maybe the individual says what he's thinking, every other person is hearing it. That his thought is no longer private to him or her. Number two is that another symptom might be that the individual may be saying that if he is doing something, he might say that it's not the one that is doing it. It's other people that are making him to do that thing. Because normally everybody should be responsible for his action. If I do something, I should own up that it's me that do it. But the person that is having schizophrenia will say that whatever they has done, he is not the one that do it. Maybe it's an alien, another type of people that are responsible for that particular thing that is doing. Number three is that individual might be saying is hearing voice of people talking about him or talking about what he's doing. Sometimes somebody may come, that's the number, somebody may come and say, okay, maybe there is tiger inside me. talking of a belief that is bizarre, that does not make sense, that is not reasonable. So in that, other categories are maybe somebody is aimless, somebody is talking out of point, or even trying to bring another language that does not exist. So what happens is that if an individual has one of the category A, which is, even let's say for example, is just hearing voices or people talking about him or people saying something about him, that having one is enough to say the person has schizophrenia. If he has two of the second category, the individual may be said to also be having schizophrenia. So now, after that, the doctor will order for maybe some routine tests, which at the end of the day, the tests are mainly to know the baseline, maybe like routine, like food blood count, like liver functions and all the rest. So when they look at all those things, and then the next thing is that the patient will be prescribed antipsychotic. When he's prescribed the antipsychotics, so if the patient doesn't get well after because there are two types of antipsychotics. There's one that we call first generation antipsychotics. There is another type that's called second generation antipsychotics. Now, if the individual, depending on the preference of the doctor places on antipsychotics. If it doesn't get well, it might change to the second generation antipsychotics. And if that one, it goes on like that 4 to 6 weeks, maybe about 4 to 6 each for each antipsychotic that is given, is declared as treatment resistant schizophrenia. That is, that individual is no longer resistant, is no longer responding to the schizophrenia, so they might go to another drug, which is clozapine. And if the patient doesn't respond, they go on like that. But the problem with that is that most of the times, maybe about 1/3 of patients gets better, maybe 1/3 at least will be manageable, 1/3 will not even respond, even despite all these treatments. And so that is why most of the times, patients that are having schizophrenia become burden on their relatives, because they will not be able to do anything. Though they may not be aggressive, they may not be anything, but they will not be able to function. That is why we are now talking about rethinking schizophrenia. Rethinking schizophrenia is that there are new perspectives, and even from the criteria that they use to diagnose schizophrenia, there is a caveat at the end of the day that says that if you cannot demonstrate any maybe pathology at the level of the brain or any other place, that is when you now say it's a schizophrenia. But now the new perspective is functional medicine. This is talking about the root cause approach. The traditional method does not think about the root cause. It's only managing the symptoms. That this person is hearing voices, they give drugs to manage the voices. This patient is not sleeping, they give drugs to make the patient to sleep. But this new perspective is that we now begin to look at what are the problem that is causing the symptoms of schizophrenia. And then now, and that is why now there are a lot of evidence that now shows that nutritional deficiency as major factors in contributing to the development of schizophrenia. For example, that is why we now know that there is a even connection between the gut and the brain. So whatever happens in our gut can affect our brain. So if in our gut, we have a lot of microbiome, a lot of microorganisms that are staying there. Their work is to, our own responsibility to them is to feed them. Their own responsibility is to protect us. They will allow some, because when we eat, there are some things that are not supposed to get into our system. Those microbiome are there to prevent what is not supposed to enter, not to enter, and allow what is to enter. Even if we eat and then even the food is contaminated, those microorganisms that we have in the gut will fight and destroy those organisms. But now we are to also feed them for them to continue to serve us. That if you don't feed them properly, maybe by our diet, by the type of food that we eat, if we don't feed them properly, they begin to die. So they are not able to do their function. At the end of the day, what is not supposed to enter begin to enter. And these things also find their way into the blood system, and the body see them as a foreign agent, and then it develop a kind of soldiers against them, and the body begin to fight them, and this leads to inflammation, and if inflammation can lead to the development of symptoms of schizophrenia. So there are so many other things too. All these neurotransmitters that we are mentioned, the chemicals in the brain, we say the chemical imbalance. The serotonin that is even responsible for the depression, about 70% of them is produced in the GIT. And then the raw material to produce this also come from our food. So if you don't give a food that is rich enough to supply the raw material, that neurotransmitters may not be produced, and then it will be deficient, leading to development of mental illness. Another thing that can also happen is that even the synthesis of those chemicals that we say is not balanced, they are each stage of them, they need some micronutrients for those enzymes that are responsible for producing those chemicals. They need some micronutrients like vitamin and maybe minerals like zinc, like magnesium, to be able to produce those things. But we are not looking at all those things. We rather look at that there is a chemical imbalance, and we address the imbalance without looking at what is causing the imbalance. So that is why we need now to have this new lens of looking at this schizophrenia, looking at the root cause of the problem, not trying to manage the symptoms as we have been managing before. And this has shown a lot of promise. I'm going to talk about some patients that I've managed that using the root cause approach. There is a patient has been maybe he developed schizophrenia at the age of 19. So I was in Lagos when they brought to an hospital where I worked. Then later he started following me up, and then later we now say, okay, let us even use this approach to address this problem. So we begin to look at there's something we call functional lab testing. We look at all the micronutrient panels. We discover that this patient has low vitamin D. He has a problem with vitamin B12, and then we corrected all those ones by giving those supplements, vitamin B12, and then we also try as much as possible to, and then eventually we just discovered that this patient, after about 3 months of being in this vitamin B12 or being replacement, most of the symptoms just subside, and then we begin to reduce the antipsychotics. He was on, as at the time we started, he was on about 3 or 4 antipsychotics. But by the time we now discover that now presently is on the lowest dosage of only 1 antipsychotics. In fact, we are just being cautious. That is why we have not been able to stop the antipsychotics. Then number 2 is that where the diet comes from is that evidence has also shown that high level of sugar can cause inflammation in the brain, which can lead to the symptoms of schizophrenia. And then this has also been why people are now talking about ketogenic diets, because ketogenic diet can also be an adjunct to the treatment of schizophrenia. I've also had a patient where I have to at least comment on ketogenic diet, and then in addition to the antipsychotics. But he was on, after maybe about 12 weeks, most of the symptoms, this patient has been not responding to any medication before he started responding. He started doing well. He's currently on ketogenic diet and is doing well, though he's still on medication. But this challenge we have with ketogenic diet, because most of the recipes are foreign, and then it's always difficult. This person, I was able to, because of the fact that he had somebody, the mother has a lot of knowledge of diet. At least the mother is a dietitian, so we're able to. And then the mother travels out of the country. We're able to get those recipes without any problems. So even now, we also try as much as possible to. There's another patient that this patient, he was also hypertensive in addition to having schizophrenia. And then this patient, we also do our panels. We discovered that he's sensitive to a food called gluten. when we do laboratory, we saw the food sensitivity, and he was having the symptoms of schizophrenia. And when we now remove this food from his diet, the patient is doing well. There are a lot of countless number of them like that. So in addition, we also know that lifestyle factor can also hello.
Before you go into the lifestyle,
Okay.
can you hear me, sir? Can you hear me, Dr.
All right.
Abimbola? So before we go into the lifestyle, so beyond the diets that we've talked about, now I know that wrong diets, wrong thing that we put into our mouth and stomach can cause schizophrenia. So I want to ask something, that what is the relationship between diets and the brain, sir?
Okay. Our brain needs a lot of energy. In fact, the brain requires 20% of the total energy that the whole body uses. So what happens when we are feeding our so that is, I just mentioned ketogenic diet.
Yes.
What happens is that our body is what do I call it, is like an hybrid car, which requires to which can be powered by two types of fuel. The first one is from glucose. The second one is from ketones, which is fat. So, like when I was talking about the etiologic factors of schizophrenia, I mentioned that one of the etiological factors that what they found was that in the brain of the patient with schizophrenia, they found that there are some issues at the level of the structure of the brain. So the patient with schizophrenia cannot use glucose optimally. So and because of the fact that they cannot use glucose optimally, then it requires a lot of energy. For us, where I'm talking to you now, you are talking to me, there is a lot of activities going on in our brain for this to be happening. And because of even the production of neurotransmitters requires energy. So the mitochondria, which is the powerhouse of the brain, also can be, of those patients with schizophrenia, cannot optimally use glucose. But the ketones has an advantage. The ketones is from the fat. It has an advantage in that the mitochondria, the glucose will pass through stages. There are stage 1, which is the glycolysis. Then before it moves to the other stage, without being able to, the first stage, it must pass through that first stage before it can go to the second stage. But the ketone can bypass the first stage, which is usually impaired in patients with schizophrenia. So the ketone now is an efficient supply of fuel to the brain for those people who cannot use, for the brain that cannot use glucose optimally, which is what we see in patients with schizophrenia. That is number one way the diet can affect the brain. Number two, the diet, that the food that we eat, these neurotransmitters that we use, the raw material for the neurotransmitter come from diet. So if our diet is not balanced, then the brain might have problem producing those neurotransmitters that it requires to function. Number three, each stage in the production of those neurotransmitters requires some micronutrients. Like I mentioned before, I said some of them require vitamin B12, vitamin B6, vitamin. So if there is no adequate supply from the diet, the individual will not be able to produce that neurotransmitter as it's supposed to produce it, and then it will be, unless it will not develop mental health problems. Those are, and then like I also said, the last one is that the diet, there are some bacteria in our intestine, in our GIT, that is also communicates with the brain. And then most of the neurotransmitters that we're even talking about are produced in that GIT by those bacteria. This diet that we eat, they feed those bacteria. So that, for example, all the soluble, most of the fibers in our diet, those bacteria, that is their food. It's only when they get this food that they can also produce those chemicals that we need, that we can communicate with the brain and make the brain to function normally. I think I am able to answer your question.
Thank you so much, sir. So, if you can hear me, to my audience out there, you've been hearing Dr. Abimbola talking about how we can redefine schizophrenia. And I'm sure out there you have somebody, you know someone that needs this information. You need to share this life to them so that all of them can benefit from Dr. Kazeem Abimbola. And also, if you have any questions regarding schizophrenia, how your like, if you know anybody, if you have any question that you need to ask, please you can drop it inside the comment section, and Doctor will answer them. So let's move to the final lap and talk about the lifestyle. How can we improve lifestyle of a schizophrenic patient? Thank you, doctor. Did you catch the question, doctor?
No, I can't hear you. I didn't hear that. I didn't get that area. That's what you just said now.
To the lifestyle. What's
Okay.
that's the last lap. Like, what's the lifestyle? How can a schizophrenic patient, how can they change their lifestyle? And also to buttress this point, after you are done with the lifestyle, I have a pending question in me to say that can a schizophrenic patient, can they get permanently better or cured in the long run? Thank you, sir.
Okay. Like any chronic medical condition, our lifestyle matters. And so as a schizophrenia, like we have seen that stress, like the question you asked the other time, that
Yes.
if you say somebody maybe is traumatized, and then can it develop schizophrenia? When somebody is stressed, it can also have a ripple effect. There will be high level of cortisol. This cortisol can affect the brain and can even alter the balance of the neurotransmitters in the brain, which can lead to the development of symptoms of schizophrenia. Cortisol can also affect the balance of those good bacteria in our gut, and then it can affect them, and then so we can as a result somebody can develop a leaky gut, which can allow something that is not supposed to enter into our enter, which may cause an inflammation, which can eventually lead to a problem. So stress is a very important thing that we need to manage, and that is a patient. Not even everybody must try as much as possible to manage their stress. Things like deep breathing, mindfulness can help to manage the stress, and therefore reduce the vulnerability to development of mental illness, including schizophrenia. Number two, sleep is very, very important, because when there is adequate sleep, it also helps to decrease the cortisol level, and by extension, because when we sleep, it is when we sleep, we just don't sleep. We just don't sleep. When we sleep, the body is doing another thing. All the things, like for example, now today as we are talking, we are generating a lot of chemicals, a lot of molecules. Some of them are dangerous to our brain, and which can lead to development of symptoms of schizophrenia. But by the time we sleep, then that is the time the body will be clearing those things away, so that by the time we wake up in the morning, then our brain is cleared, and then we are able to start the activities of the following day. So, but when we don't sleep well, all those chemicals that we have generated that can damage generating more, which is going to continue to damage our brains and disrupt all the balances of the optimal functioning of the brain. Then substance use, like we have seen that there is an association between the substance that we use and the substance that we use and like cannabis, all those hard drugs can lead
Yes.
to development of symptoms of schizophrenia. So all these things together, adequate rest, manage the sleep well, avoid hard drugs, exercise is very important because exercise can lead to the development that can lead to increased production of brain-derived neurotrophic factors, which can help the brain to function normally. So all those factors, we also concrete in the rethinking the schizophrenia. While we look for the root cause, we also address the lifestyle of the patient by way of trying to determine what they eat, encourage them to sleep well, and then help them to manage their stress. Combination of these things make the patient to get an holistic healing. As in the area of cure, I am not going to because now the new treatment and the new approach is giving us a lot of hope in the management of schizophrenia. But we now, because of the level of evidence, we are not going to say it is cure. But like I'm telling you now, if we are able, because energy flows where the focus goes, if we are able to get the root of the problem and we address that problem, I think that the solution to that problem is already in sight. And like I said, I have a patient now that I've been managing for the past 1 year now. The other ones, they are doing well, but it's just the fear of, okay, but with this one, together with the patient and the relatives, we say, okay, let us stop this antipsychotic. And we have stopped this antipsychotic for the past 1 year. The patient is doing well. The patient and there is no any symptom. He has gone back to school and is functioning optimally.
Thank you so much, Doctor. So, some people used to say that, we are living in a religious country, whereby some people would think that, okay, I'm hearing voice of God. Some people can just wake up one morning and say that, okay, they are the devil, they are God, they are this and that. And now you showed us that, okay, that diet also can be a contributory factor for schizophrenia. So now I want to ask something, Doctor, to round it up, that if a person is probably hearing voices, the person is probably thinking that, okay, something is entering me, like I feel like something is swallowing me, or somebody understand my thoughts, how can their caregivers, I mean people that that surrounds them, how can they effectively take care of them, manage them, and understand their conditions, and know that at this stage how to help those patients? Thank you, Doctor.
Okay, thank you for the question, because that is what we do face all the times, and patients hardly come on time to the hospital. Before they come to the hospital, they will have gone to shop around, go to herbal home, go to spirituals, whatever. Before, it's only when they don't get results that they now come to the hospital. And then it is better when the patient come immediately the problem starts. The outcome is mutually better. Well, what I want to say now is that schizophrenia is a medical condition. It's not a spiritual problem. And it's a problem that can be addressed and even better addressed when they present very early. So if somebody is having this problem, we just try to investigate and find what are the problem of what is causing this problem. Once we are able to identify the root, then we remove the root, and that may be the end of the problem.
It remains you to answer this question about for the caregivers, how can they,
Okay.
make it better for them, their families? How can they encourage them to people that are hearing us?
Well, the caregivers should be able to, like that is what I've just said now, that these symptoms are just medical symptoms, because I've been doing this thing. I think I have about nearly 2 decades of experience in managing mental illness. We have discovered that at the end of the day, when people go for spiritual this thing, they ever end up in the hospital, and it's when we treat that they begin to get well. So what I just want to tell them is that whenever there's any problem, they should just present in the hospital, bring their wards to the hospital on time, because when they come on time, they get better results. I don't know
Thank you
whether
so much,
whether
Doctor.
I'm able to address
Yes, yes,
your
yes,
question.
yes, 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 yes. Dr. Kazeem, this has been incredibly insightful. And, you know, can you hear me, Doctor?
I can hear you now.
Yeah, okay. Any final encouragement for someone on this journey? Like final
Well,
encouragement, yeah.
if you have somebody that is having schizophrenia, it's not the end of the road. There are there is a lot of solution, and there are more and more advances in medical science that even now make life easier for those who are suffering from schizophrenia. I've had several patients with schizophrenia that are now functional. Now have gone back to their work and are doing well in the society. It's just for you to have the right information, and you have the right knowledge, and to meet the right person. I believe that if you have anybody that is suffering, it is high time that you bring them to, you take them to any mental health facility around you, or see somebody, especially those who use the root cause approach to managing schizophrenia.
Thank you, Dr. Kazeem.
You are welcome.
And to everyone watching, just remember you can consult with Dr. Kazeem right on the TeleDoc app. If you have any friend, anybody, any colleague that have schizophrenia or have any mental issue, you can consult with Dr. Kazeem. Just download TeleDoc app, search Dr. Kazeem Abimbola Uthman, and book your session. Till we meet again for another wonderful live session where we share insights. Till we meet again, goodbye.